Biparietal diameter (BPD) is an essential biometric parameter measured during obstetric ultrasound. It represents the transverse diameter of the fetal head from the outer edge of the near parietal bone to the inner edge of the far parietal bone. Accurate BPD measurement helps estimate gestational age, assess fetal growth, and monitor development throughout pregnancy. Fetal cardiac activity shows rhythmic heart contractions, confirming viability. Normal heart rate between 110 to 160 bpm indicates healthy fetal well-being. Femur length reflects fetal long bone growth, measured from one end of the shaft to the other. It assists in estimating gestational age and monitoring skeletal development. Anterior placenta attaches to the front uterine wall. It usually has no adverse impact, though may slightly cushion fetal movements or complicate early heartbeat detection. Amniotic fluid volume appears normal, suggesting adequate cushioning and support for the fetus, promoting proper growth, movement, and lung development. Ultrasound suggests female fetus, evidenced by absence of male genitalia and visualization of labial structures, confirming baby girl gender identification. Fetus lies longitudinally with head presenting downwards in cephalic position, optimal for vaginal delivery and indicating normal intrauterine orientation.